There's not going to be many of us listening here tonight that hasn't once thought during their practicing career, I just wish I could see deeper than the skin, or wish they'd already had a radiology result immediately. How many of us have gotten frustrated with the turnaround time from initial assessment to patient making an appointment with radiology and getting the results, and getting the patient finally back in to try and implement a treatment? Sometimes that's 2 to 3 weeks. And if it's just to confirm if it's actually the plantar fasciitis, the plantar fascia that's thickened, or calcaneal spur, it can be very frustrating. Good evening, everyone. I'm Calvin Sinnett from Cape Podiatry. And tonight I want to share my story of how ultrasound has transformed not just how the diagnosis process, but how it's changed my daily practicing life. And since the move to Cape Town, it's how it's changed the landscape of podiatry in the Western Cape. It's not a talk about machines, but it's really how better imaging has changed how we help our people move without pain. Our ethos in our practice is to manage a diagnosis. Should you not have a diagnosis, do not manage a patient. And this is what in-house ultrasounding has done for us. Please note, this is my story. The brands that I mentioned, I've personally funded all the costs, and there's absolutely no incentives. And I also really hate fig jam talks. And if you don't know what that is, please give it a Google. So I certainly hope it doesn't come across like that. I just want to share my story to hopefully inspire someone to take the leap. My first ultrasound machine arrived 2 days before South Africa went into lockdown 2020. I honestly, at that point, had no idea how pivotal that decision was and how it would change my life. In the early days, I started with a Vino A5 from Impilo Medical, as they had no other stock of ultrasounds at that point. And the world was ending. It was an absolutely great machine for me to start off with, that I admit. I was still learning how to interpret what I was seeing. It all looked absolutely as clear as mud. My pro-wife became my leg model, as we had really nothing better to do, and the Netta my best friend. There was a whole lot of oohs and ahs and oh wow, is that what it looks like under ultrasound? Followed by, wait, I'm on the wrong side of the foot. Back then, I still often relied heavily on external radiology, and that delayed care. But the idea of having an ultrasound right in the room planted a seed. It showed me that real-time insight was possible, even if the workflow wasn't perfect. The most important thing to remember is having in-house radiology doesn't stop the need for confirmation or reporting. It's there to confirm your diagnosis. If you need help, send it out. And what's the most important rule of ultrasonography? You need to look at least 100 normal anatomy before you can start to look at pathology. I adopted ultrasound because as podiatrists, many of our pathologies are soft tissue based. Tendons, fascia, ligaments. They don't often show up on X-ray either. And finding good ultrasonographers at times can also be difficult due to their demands. One of my mentors was also using ultrasound quite extensively by this point. And the hard part was trying to keep up with my colleague. Yet if you don't have cutting edge equipment, it makes it hard. More importantly, it also leaves you with doubt that you could be missing something. Ultrasound has given me a dynamic image, one that I could move joints, load tissue, and actually see the pathology respond in real time. It stopped it being from theoretical to becoming visible. As a podiatrist, we have a scope that's open to assessment, diagnostic, and management for our patients. With the use of ultrasonography, all medical professionals out there, once comfortable with the process, are able to give with greater confidence the correct diagnosis to their patients. Let's all be honest, the first time we did a simple hip or knee assessment on a paying patient, important paying patient, we definitely doubted ourselves. It's the same thing with ultrasound. But the best part is you've got an external radiology department to send out for should you need assistance. The dark days of COVID were here, and I had a very expensive toy that I had to pay off. The weekend before lockdown started, I was meant to be in Dubai for a 2-day lower limb entry-level hands-on ultrasound course by a company called Sono Skills. And that was meant to be followed up with an ultrasound injection course in Amsterdam later 2020, but obviously all cancelled. Thankfully, Impilo Medical do run regular hands-on ultrasound courses that focus on different regions of the body, which I attended mid-2020, which was an absolute game changer. Being able to play with your own ultrasound machine with qualified ultrasonographers at your side makes such a difference. Learning tricks of the trade, making yourself comfortable, and making yourself comfortable with a toy builds confidence. After this course, I really felt comfortable using the machine and the game started. How many people through a day can I ultrasound? Everyone from an old granny with a simple corn, I used to do a vascular study on them, to a runner with a discolored nail, I'd want to check the integrity of the plantar fascia and the Achilles. I never charged for this, but all I wanted to understand was, what does normal look like? And I use the word normal very, very loosely. The more you see, the more you start to see. It's an incredible concept in ultrasounding. But COVID opened up a wonderful world of Zoom meetings and online courses. Sono Skills also offered many courses online of varying levels of different fields of ultrasound. Their pre-recorded content is vast and at very good level. Thankfully, during COVID it was free. Currently not so free, but still a phenomenal site to really good input and insight. The more you see, the more you start to see. The more you start ultrasounding, the more the picture just becomes so much more clear, and you start saying, "Jeepers, that's that." It just becomes quicker and just more fluid. Later 2021, the doctors from Cape Sports Doctors down at Sports Science hosted Mark Schmitz from Sono Skills, and they run an upper limb and a lower limb ultrasound boot camp, which is 2 days of upper limb, 2 days of lower limb. And it's really a great course to get hands-on work. I did the lower limb course for obvious reasons, but it was also absolutely another turning point in my confidence in ultrasounding. They run this course generally once a year at least. As lockdown was starting to be over and the world started to became smaller again with regards to travel, I wanted to do more with my ultrasound, but I wanted pieces of paper behind my name to prove the skills that I've achieved. My next adventure was off to London 2022 for a very pricey but absolute worth Friday. I went all the way for one day. I got in contact through the algorithms of Facebook with the gents from ultrasoundsite.co.uk. They offer also fantastic online courses and possibly not as visible as Sono Skills, but really good foot and ankle stuff too. They do a lot of shoulders as well and full body. What they do, they actually offer a foot and ankle ultrasound guided injection course on theal embalmed cadavers. And if you haven't come across a theal embalmed cadaver, it's absolutely life-changing. As one, there's no smell, but two, the bodies are actually soft and they have natural lifelike features. You can absolutely move the body totally. One day practicing seeing needles under ultrasound and utilizing different gauges of needles to understand the differences of what you see, hydrodissecting Achilles and aiming for neuromas is really quite life-changing. Same story, linked good foot and ankle surgeons with you, ultrasonographers teaching you what to do. The best part also is practicing blocks without patients talking back to you. Definitely refines your skills. We've also done in the Cape, blessed to have Bev Riss come down and help refine our skills and also looking at pathologies. The more you look, the more you see. And in a team aspect that we've got, we're very lucky to be able to discuss different cases internally in the business and see how other partners are seeing different things, as well as looking at each other's images and how would we better that or improve what we're seeing. Fast forward some time and seeing what the potential ultrasound can do. All the podiatrists at Cape Podiatry are now trained in ultrasound. We've bought a second machine. We've got the Sonoscape A1 Expert from Impilo again, a brilliant little machine, where I used to spend about 5 minutes to basically line up the patient, get him organized, get the probe organized, get everything to go together. I can normally do that within a few seconds. You build protocols in your head, which makes more and more sense the more time you do it. Each person's got their own protocol. And why do they do it that way? They don't know. They just do it that way because it just makes sense. Same as assessing a hip. People often ask, what's the resolution like of your machine? It's a regular question. And it's something that the sales people of ultrasounds always pitch on. But what I can tell you, the more time you look at images, the picture doesn't actually have to be very good at all for you to know what's going on. Spending more and more time behind the machine means you can see subtle tendinopathy changes and tears that just simply couldn't be seen before. Most of the time, it's not the machine, it's actually the person. And the nice part about when I went on the Sonar skills as well as the ultrasound science courses, you would go in there and there's about 6 or 7 different types of machines, possibly same manufacturer, but definitely from entry level to ultra 1.5 million rand machines. And it just comes down to time. You just want to spend time doing it. Ultrasound is now part of almost every assessment we do. When a patient walks in with heel pain, ankle swelling, or forefoot numbness, we don't need to guess. We scan it. It's become normal as taking a patient history or grade assessment. It's changed how we plan our interventions. Even our orthotics prescriptions have improved. Understanding tissue load, pathology depth, it allows us to design support more precisely. The result is for patients is the result patients get is faster, treatment starts sooner, and outcomes are more predictable. But if we have doubt, patient goes for formal radiology. Unfortunately, not my record, but my business partner's record is a patient kicked their toe on a Thursday. That Monday morning had an appointment to come see us. He did an ultrasound and diagnosed it with a plantar plate tear, full tear. Patient managed to see the orthopod the next day, and by Thursday he'd already been operated on and discharged, and the repaired ligament was done. If we did have this technology in our rooms, this would have taken weeks, and it would definitely not have been possible to knock out what we've done. We also build trust with our surgeons we work with. If we diagnose something, we're thankfully not often too far off. We had a patient a while ago, and it's actually a lovely relationship we've got with our top foot and ankles down here, where we might send off for, this is a neuroma, please assess and manage. And 9 times out of 10, we get a picture back and said, this was the neuroma that was in it. It was this big. It matched what you saw. And that's just so reaffirming that what we're doing is good stuff, and we're helping our patients get the right treatment at the right time continuously. And it's really rewarding that our skills are paying off. The patient experience is the biggest winner. When someone can see their pathology, like a degenerative Achilles tendon or a thickened plantar fascia, they understand the problem instantly. Compliance skyrockets because it's no longer abstract. They can literally see what we're treating. It's also deeply reassuring to them. There's something powerful about being able to say, here's what's happening, and here is how it's improving, instead of, let's see if it gets better. We now use an ultrasound not just for diagnostics, but also for progress. That visual feedback is an absolute game changer for motivation. I had a patient recently, she came in adamant, plantar fasciitis. I've got plantar fasciitis. In fact, I've had it for a year. I've seen physio, shockwave, this, that, bells and whistles, done everything that they could do. And then all of a sudden got better when she changed her shoe. How does changing a shoe make plantar fascia go away? Puzzling. But now it's back and she's got a big adventure coming up, but she's got plantar fasciitis. I said, okay. Should we ultrasound it? No need to. I've got plantar fasciitis. Well, we're going to anyway. Put her down. Oh, hold on. Your plantar fascia is normal. In fact, you've actually got plantar fasciitis on the other foot, but you don't have a spur on the other foot. The foot you're complaining about actually has a massive heel spur. That changes how we manage patients and changes how we're going to impact them and make a big difference in their life. I like this picture. This picture is an old picture of mine, not the greatest quality. But what it can show you is how the plantar fascia originates from its insertion and runs down the foot and where you start to see how it starts from a much thinner aspect and how the change in shape starts to define what's going on. As you go down, the fascia starts to thin out more and more. It's just when I was going through all my records, one of those nice ones to find. I couldn't find the stress fracture when I was looking for, but I can tell you the day I found that stress fracture, I ruined the prospects of that patient's marathon that they were meant to run that weekend. For the practice itself, ultrasound has made us more efficient. We can handle more in-house cases. We reduce the need for external referring, and give patients answers immediately. It also has elevated our collaboration with sports physicians, physios, other allied health workers, orthopedic surgeons, and all the professionals we work with, because our scans provide real-time data that they can act on. The repeatability of ultrasound also means that we can track healing objectively and not just subjectively. And it's invaluable for both patient care and documentation, especially with the amount of malpractice issues at the moment. It's very good to be able to have that proof. Ahead, I mean, ultrasounding is the whole field of medicine is evolving at such a rate that it's actually quite mind-blowing. AI-assisted imaging is already starting to help all the big radiology departments with auto measuring and landmarking. Unfortunately, we're not there yet, but we're definitely on the train. We are trying to do better. Oh, 1 second. Oh, go back. For me, this journey of ultrasound has been one of the most rewarding evolutions in my practice. It's proved accuracy and confidence and trust, both in mine and my patients. It's improved. Technology keeps changing, but at the heart of it, it's still about helping people move better, faster, with fewer barriers. Ultrasound has given us a sharper lens to do what we do and do it the best. What is the most common question I get? And I guarantee you probably one person is wanting to ask. So what do you charge? And I'm going to be honest with you, nothing. We charge absolutely nothing for ultrasound for 2 reasons. First reason, we don't always give reports, and we can give a report and we can give images if patients request it. But the reason we don't necessarily always do it is as part of our treatment process. It's what we utilize to get a diagnosis. And the second thing is why we also don't charge is we don't have a code for it and we don't feel it's right. The difference of having an ultrasound in our practice versus potentially not a competitor but a colleague is it just changes the patient's buy-in. It changes how we can manage them. And what it does is it changes the word of mouth and the referring network. When patients hear that you've got more technology and you're using it wisely and correctly, patients really want that. They want state of the art and they want answers and they want it now, not in 2 weeks' time. Thank you, guys. It's all about helping people move better. I hope this helps.